Physiology of aging. Integumentary system. Hint, this may be on your exam. Thinning and wrinkling of skin. Decreases collagen and elastin in the dermis. Skin cancer increases. Vulnerability to UV rays. Increased incidences of heat stroke. Loss of functioning sweat glands. Decubitus ulcers. Loss of fat pads. Graying, thinning, and loss of hair. Decrease in the number of hair follicles with less concentration of melanin. Normal changes, the skin wrinkles, becomes lax and loses trigger. The vascularity of the dermis decreases and the skin of white people begins to look paler and more opaque. Brown macules, called lentigines, appear on the back of the hands, on the forearms, and the face. Seborrheic keratosis and asthenic keratosis may develop. Nails lose their luster and may become yellow and thickened. Implications for the radiographer. The skin of the geriatric is fragile and thus more easily traumatized. You must ensure that the skin of the elderly patient is not damaged during your exam. Lying on a hard radiographic table may be especially painful for the geriatric patient. Place a full table pad for comfort, if you have one. Nervous system. Loss of myelin in axons. Brain tissue damage due to arteriosclerosis or decrease in blood flow. Slows in the speed, coordination, balance, and fine motor skills. Cerebral infraction leading to dementia. Depression. Depression is a common and debilitating emotional problem of the aged person. This condition can be due to the following reasons: a burden to the family, the fear of losing one's good health, giving up independent lifestyles, chronic illnesses. Symptoms of depression in the elderly person are often confused with also dementia. Alzheimer's disease. Persons with Alzheimer's disease present with symptoms of dementia, which usually occur in persons over the age of 65, although it may occur in an earlier time. Recent studies have indicated that of people over the age of 65 years, about 50% suffer from Alzheimer's disease at very. When an examination of the geriatric patient is complete, you must assist the patient with returning to the dressing room, caretaker, or waiting room. The elderly patient must not be left alone in the radiographic imaging room, because he or she may become confused and may be in danger of falling from the radiographic table. Sensory system, like your eyes. Change in the lens of the eye affect your focal length. Distorted color perception and cataracts. Changes in the retina reduce adaptability to different light levels. Sensory system, such as your ears, hearing loss, loss of tone discrimination, speech discrimination is impaired. Musculoskeletal system, osteoporosis, past the age of 40, degeneration joint disease, osteoarthritis, affecting 50 plus million Americans, second most common cause of disability. Changes in the head and neck, normal changes of aging. There is mild loss of visual acuity, particularly presbyopia. Tear production is either reduced or increased. Sensory, neural, and conductive changes occur in the ear. Hearing loss is common. There is loss of muscle mass in the neck, and also kyphosis. Implications for the radiographer. Assist the patient at all times. Sudden change in lighting may cause momentary blindness. You must ascertain that the patient is able to hear your directions and speak loudly enough for your patient to understand. Be especially careful to clearly state instructions and check for understanding. Cardiovascular system. Maximum heart rate decreases. Loss of arterial elasticity, which can create blood pressure problems. Arteriosclerosis. Ulcerations, clots, and aneurysms. Gastrointestinal system. Decreased rate of gastric acid production and secretions. Decreased motility of the smooth muscle in the large intestine. The immune system may decline its function. Normal changes of aging. Gastric secretion, absorption, and motility decreases. The abdominal muscles weaken. Many patients are edentulous, which just means without teeth. They have dentures or partial plates. Esophageal motility declines as well. Implications for the radiographer. Due to patient fasting, schedule the exam early in the morning so that the patient can have breakfast close to their usual time. You must instruct the patient to drink slowly to avoid choking. Position the patient in an upright position to prevent aspiration. The respiratory system. Lungs lose elasticity, which traps air. Muscles become more rigid. Rib cage stiffens. Hematological system. Bone marrow production also decreases. The pulmonary system. Other normal changes. Lung capacity diminishes. The cough reflex becomes less effective. The normal respiratory defense mechanism lose effectiveness. Implications for the radiographer. Patients with chronic pulmonary disease cannot be expected to lie flat for more than a brief period of time, since this position increases dyspnea, which just means difficulty breathing. During the chest radiograph examination, when possible, ask the patient to hold his or her breath on a second full inhalation to ensure full lung expansion. During an upper GI or UGI, position the patient in an upright position to prevent aspiration. Genitourinary system. Changes in bladder capacity and muscle structure decrease the number of nephrons in the kidneys. Endocrine system. Inadequate response to thyroxine. Pancreatic dysfunction. Patient care of the elderly. Patient and family education. Take time to educate the patient and his or her family. Communication. Speak lower and closer. Treat the patient with dignity and respect. Transportation and lifting. Give the patient time to rest between projections and procedures. Skin care. Avoid adhesion tape. Provide warm blankets in cold examination rooms, and use table pads and handrails. Contrast administration. Always assess the patient's medical history before contrast media is administered. Age, liver function, kidney function, thyroid function, and medication history. The patient who has had arthroplastic surgery. Total joint replacement has become a common procedure in hospitals throughout the United States. Arthroplasty is indicated for patients with the following reasons: severe degenerative joint disease, joint deformities, or trauma. Most common arthroplasty in geriatrics is either the hip or the knees. Take care when doing portable radiography on patients with post-surgical arthroplasty. The most common complication after hip replacement is dislocation of the prosthesis. You must understand the needs of the patient who has had an arthroplasty so that he or she will not be injured while being cared for in the radiographic imaging. Elder abuse. It is estimated 1 out of every 20 seniors experience elder abuse. Elder abuse is the neglect, mistreatment, or exploitation of anyone aged 65 or older, or any disabled dependent adult. There are 3 categories of elder abuse: domestic, institutional, and self-neglect, or self-abuse. Recognizing the warning signs of abuse: physical abuse, sexual abuse, emotional or psychological abuse, neglect, and financial abuse. Avoiding elderly abuse or neglect during imaging procedures. Avoid pinching the patient's skin when moving or transferring the patient from gurney or wheelchair onto the radiographic table. When immobilizing elderly patients, utilize the standards of care for immobilizing the geriatric patient as prescribed by your institution during radiographic procedures. Assist the geriatric patient when they ask for help. The Joint Commission. When appropriate, the hospital considers special needs and behaviors of specific age groups in defining qualifications, duties, and responsibilities of staff members who do not have clinical privileges but who have regular clinical contact with the patients. For example, radiographic technologists and mental health technicians. And that is the end.